that if not treated right away will result in severe death, like imminent death, suddenly. So tumor lysis syndrome, so this is when, we'll talk about this more when we get into lung cancer and some of the like lymphoma. So this is when patients have a very, very large tumor burden. So in the oncology world, they'll call it tumor burden. So maybe they have a very large tumor, and basically as they start to get treatment, so as we give them chemotherapy or give them something to get rid of this cancer, that large tumor is full of a lot of toxins. Okay, when I used to work on the floor on oncology and give chemo, people would always say, why do you work on the smelly floor? Like, when you start killing cancer, it puts off almost like this chemical, metallic-y smell a little bit. Okay, I had patients that would really bother them, that they felt like they could smell this in their home. So when we start to blast this tumor, where is that going to go to be excreted through the body? Just like if you get rid of anything else in your body, how's it excreted? Your kidneys or your liver, right? So there's a high chance of their kidneys sending them to acute kidney failure because they can't handle all these toxins from these tumors. It can also kind of blast toxins to any other organ. So potentially it can send them into respiratory failure, heart failure. So we'll talk about this a little more when we get into the cancers that can truly cause this. Septic shock. So I said infection is one of the biggest reasons that safety issues for anyone with cancer, because they don't have an immune system to fight off infection, so they can get septic very, very easily. So what are some signs and symptoms of septic shock? You guys learned about shock, right?
Everything over.
What? Everything over 100. It can become really hypotensive, right? It can be a medical emergency if not treated. They will die of sepsis, septic shock. Hypercalcemia, so again, if somebody has a tumor that has spread into the bone and they are dumping large amounts of calcium into the bloodstream, they can get hypercalcemia pretty quickly. What are some signs and symptoms of hypercalcemia? You guys remember? What do you see if you have large amounts of calcium in your body? You remember? Good English review. Hypercalcemia, somebody look it up. High amounts of calcium. Tetany. They become spastic, right? What else can happen? You guys tell me. I'm gonna tell you. Just looking it up. Nausea, vomiting, severe muscle weakness. They can become very confused, very dehydrated. Kidneys can shut down. What? Very thirsty. Okay? Can become a medical emergency if not treated. They can have idiopathic bleeding, so they can just bleed for really no reason. I have witnessed somebody truly almost dying from a nosebleed because they had literally had no platelets to clot. And nothing we were doing was helping. And we were dumping platelets in and their body was consuming them faster than they could utilize them. And they literally almost died from a nosebleed. Surgery had to come in and cauterize, lots of ice. We were giving everything we possibly could, and this person literally almost died from a nosebleed. DIC can happen, so I already said cancer can disrupt the blood flow. It can make blood very thick, and also they don't have platelets to clot, so they can be clotting and bleeding at the same time, which is what happens with DIC, right? You guys learned about DIC at some point. Okay, so we'll talk about some of these things when we get more into the specific cancers. Psychological. If I asked you guys if somebody was diagnosed with cancer, what was worse, the physical component or psychological, what do you think you'd say? probably psychological. Okay? So let's do this. Okay, I have 7 cards here. So get into, there's 20 of you. So get into groups of 4. And I have scenarios written out on these cards, okay? So in your group, I want you to read the scenario, and I want you to seriously think about if this happened to you, what's on this scenario right now, okay? So obviously these are cancer diagnoses or situations. So if this happened to you, I want you to think about the 3 most significant people in your life. Now for everybody that might be somebody different. For the moms in the room, that might be your kids. For some of you, that might be a boyfriend, fiance, it might be your parents, it might be your sibling, it might be a best friend, okay? Everybody has at least 3 people who are very significant in their life. Or I hope that you all have at least 3 people that you can rely on in your life, okay? So think of those 3 people. Who are they? Because if you were told today that you had cancer, that would be probably the first 3 people you would tell, right? Okay, so as you guys read through these, I want you to think of telling those 3 people in your life. How would they respond? What would their reaction be? How would you tell them? Okay, what would your response be? Okay, the movies do a really terrible job of displaying when people are told they have cancer. It's always like in an office setting, they're sitting across a wooden desk, and they say you have cancer, and then they go into some spiel. That is not how it happens in the real world. They tell them in a clinic setting, typically, in an office, where other people are there getting treated. Maybe other people are in the lobby who look extremely sick, like they're going to die, where people are getting chemo for the first time. So when people hear those words, you have cancer, what happens to their brain? It completely shuts down, and they hear nothing else. They hear nothing else. I have had people tell me their family will call an hour after they leave the clinic and say, I have no idea what they said to me because that's all I heard. One of the best surgeons I've ever worked with was a breast surgeon, and when he would see patients who he was going to do surgery on for their breast cancer, before he would agree to do surgery, he made them say, I have breast cancer, and this is how I'm dealing with it. Because if the patient can't deal with it, then they don't need to be going through surgery, right? So the psychological component is huge, huge. Okay, so maybe some of you have dealt with cancer personally in your lives, or know someone close to you, so this might be harder for some of you than others, but I want you to truly think about, if this happened to you today, how would this affect your life? You guys are all in a prime time of your life. Like seriously, this is like prime time. Like I would give my first child to go back and maybe not. I'm just kidding. But you guys are in a prime time. You're getting new jobs, your careers are starting. It's awesome, right? It's very exciting. But what if something all of a sudden ripped the rug out from beneath your feet and changed your plan? Because that's what cancer does. It takes all control away. You could talk to 1,000 people diagnosed with cancer, and I guarantee the thing they would agree on that is the hardest is losing control. The loss of control. And that's any like long-term chronic illness, right? If you were told you're diabetic today, and now for the rest of your life you have to deal with diabetes, it's going to change your thinking a little bit, right? It's going to change your physical way of living a little bit. Okay? So this hopefully will help you guys kind of empathize a little bit with people going through this. So get in little groups of 4. Pick one of these cards. Now some are female specific, some are male specific. So make sure there's some girls in your group. And some of you could play like a family member. Let's just roll